Hi, everyone. Welcome. Thanks for joining us tonight for an Ask Julie Anything session. And tonight we're talking about dental health in our animals. So today we've got Dr. Margo Roman with us. Hi, Dr. Margo. Thanks for joining us.
Thank you.
And Julianne Lee. Everyone's familiar with Julie. Hi, Julie. Thanks for being here. I just want to say, before we get started, a couple housekeeping items. If you wouldn't mind, let us know if you can hear us. I see Darcy in the chat here. And if we could use the chat for the chatting, and we can go back and forth during the session. And then if you've got questions for Julie and Dr. Roman, if you wouldn't mind, please using the Q&A button at the bottom of your screen and submitting questions that way. The session's going to run for about an hour. I'll moderate questions towards the end. And without further ado, shall we get started?
Sure.
Okay.
So I'm super excited about this because I was saying to Dr. Roman that, you know, usually all of our followers and stuff are so excited to hear it, but I'm really excited because when it comes to pet dental health and having my veterinary practice for so long, we did a lot of hand scaling and things like that because everybody's always concerned about anesthetics and you know, dental health is such an important piece of chronic disease and overall health. But we often, because we can't just do their teeth when they're awake, I mean, you can do hand scaling and stuff. It's always a sore spot. Like it was always a sore spot for me at my vet practice because I tried so hard to, you know, raw food and bones and the list goes on, but just sometimes, whether it's genetics, whether it's the microbiome, whatever it is, you know, you just wind up with these animals with really terrible teeth, especially small dogs and cats and stuff. So animal dental is a very incredibly interesting subject. And I'm so interested to hear what you're doing with it and hoping to be able to learn lots from this as well. So.
Well, you know, obviously the mouth is the beginning of the whole GI tract, you know, and, you know, I guess I should give a little background. So I've been a veterinarian 42 years and I've been studying integrative medicine for that entire time. I was very fortunate to be the first woman to take the IVIS, the International Veterinary Acupuncture course in '75 and was able to study with Luke DeShepper in 1993 and Richard Pitcairn studying homeopathy. So I have a lot of respect for as many ways that we can use so that we're not interfering with different drug therapies, that we can try to use the body's innate ability to heal itself, to help itself. So, you know, part of the interest in dentistry that I have is that I always felt that it was the opening up to the whole body and understanding more and more from taking classes and also in my own experience with having I had only one cavity in my mouth, and when that cavity was dealt with, you know, when it started to have a problem, I started throwing kidney stones, and I was like, this is so weird. Every time I touch this tooth, I start throwing kidney stones. So I went to a biological dentist, and a biological dentist is someone who looks at your whole body, not just looks at your tooth and this. And they use a lot of ozone therapy, and they use a lot of they don't want to use any amalgam. They really try to help you be really healthy in your mouth. And they had a chart in there, and the chart showed each tooth on a human and which tooth, if you have a particular problem with one tooth, what is the organ system that's affected by that? Because they are associated with acupuncture points. And sure enough, that tooth was associated with calcium oxalate crystals. And I was like, are you kidding me? So every time they touched it, I was like, this is crazy. You know, it's, you know, so when you understand that was just one, I have only one tooth in my mouth that had a cavity. So it was a good way to say, yeah, every time I touch it, I got a kidney stone. So I became a believer about these acupuncture locations and where they are in the body. But one of the biggest things that I found that was so important was the use of medical ozone for my dentals and using that instead of antibiotics. And
Right.
We know right now, which is really important for everyone here that's going, to make sure your veterinarian has read the new AVMA report about judicious use of antibiotics and good stewardship for antibiotics, because veterinarians have been overprescribing antibiotics forever. And because they didn't have another tool. And now there's a lot of other tools, and they need to know these tools and not just fall back on the antibiotics, because that's what they always used.
Their go-to, yeah.
Their go-to. Since 1997, I have not used antibiotics for my dentals. I've used homeopathy before I started doing ozone. Now I use ozone and homeopathy. And I think the two together are wonderful. And you don't need to use antibiotics. And they're realizing that now, because one course of clindamycin, which is the standard procedure that every dental group does and tells you have to be on antibiotics after you have a tooth pulled or your teeth cleaned.
Or even prior to.
With any kind of cardiac issue. Even in people, they're not doing it anymore for cardiac issues. Because I talked to a person who said, my dentist doesn't do that anymore for me, because that's considered old from the 1900s, right? So, but one course of clindamycin can knock your microbiome out for an entire year, and you may never, ever get it back. And that to me is really disturbing. So, because I, as someone who did holistic medicine, I reduced all my drugs, and I was always doing other ways of doing it. And I started to really start reading about the microbiome back about 2003, 2004. But I always used probiotics. I always used digestive enzymes. But we didn't really understand this intricate body part called the microbiome that's involved in our whole entire body. And so in 2012, I dared myself to do a fecal transplant on a dog, and it turned my whole practice around. I saw this dog who was dying at Angel Memorial Hospital, who had blood transfusions, was a mess with bloody diarrhea for 2 months, was dying, was emaciated, had Addison's. And we turned that dog, and we got it improved with the way I normally do stuff. But then when I gave the fecal transplant, it literally went like this, straight up. Mm-hmm. So we got the improvements with a holistic, but it was such a big jump that it was like, why aren't we all starting with the gut first? Because the gut is 80% of your immune system. Yeah. So establishing the immune system through the body wants to be healthy. The body doesn't want to fall apart. And that's why, in homeopathy, we look at the vital force. But if the vital force is so toxic from 90,000 chemicals that are in the environment that have killed the microbiome of that individual, I am not sure that the homeopathics or the herbs can even do their job, because we need those microbes to break down the herbs. We need microbes to be part of the vital force, to have the chi that moves all these responses. And so the more I worked with the microbiome, the more I realized that these animals would just shift. They would, you would get them better, and then they would shift. And so getting that knowledge, and just by experimenting, and of course dogs eat poop anyway, so I was just giving them good poop to eat and directing them towards really healthy poop versus dogs that were coprophagic. And we had dogs that were coprophagic that wouldn't stop eating poop. We gave them a fecal transplant from our donors, and they stopped eating poop because they were self-medicating. They were looking for something. They know innately, that that's part of the natural behavior of dogs to eat poop. When a mother dog, goes after the puppy, she's eating the poop to protect them from, predators or whatever. But it's also probably helping her regain her strength and get that youthful microbiome piece back with all the youthful digestive enzymes that are in that new puppy. And they're helping each other get stronger. So it's really cool. I love it. So back to the teeth. So why do you need the microbiome of the mouth? And there was a study that was done out of England, and I try to find the picture, but they did mouth cultures with a 16S, which is the type of analysis of the microbiome of 16 species. And they took samples on the side of the tooth, under the tongue, on top of the tongue, and the roof of the mouth. There are completely different colonies of bacteria in all these places. So just because we think it's the mouth and it should all be the same stuff, it's not. You know, this part of the mouth is completely different than this part of the mouth. And it's almost like you're living in a community and only one ethnic group lives here, one ethnic group lives here, one ethnic group here. But they all go downstream. You know, when they fall off and they break off or they die, they're going down into the stomach and then into the small intestine. And if anyone gets into watching and listening to some of the researchers in the microbiome, understanding that the small intestines bacteria is very different than the large intestine bacteria.
Totally different.
So it's all symbiotic in a way, but if we don't start out with the right, then how do we get downstream? You know, so the mouth is crucial to the downstream, and so we have to take care of that mouth. Now, in my own dogs, just as observational, in 27 years of having my line of dogs, I have never had one piece of tartar, one piece of plaque, one fractured tooth, one gingival, you know, exposure. I've never cleaned any of my animals' teeth in 27 years of having the cat and the dog.
Do you have a certain line? Is that what you
No,
said?
it's not the line. It is what these dogs. So that's the point I want to make, is that they have the line. They had the grandmother had good teeth. Great grandmother had good teeth. But why is it that we're not getting all this other plaque? So I think I've you know, not figured it out, but I think there's some really important points to this. One is I don't have any fluoride or chlorine in my water.
Yeah.
So that kills your microbiome. When the animals are licking it, it's washing their whole mouth with chlorine and fluoride, which is not good, okay? But that's in most water supplies and within cities. So you have to get spring water that you know doesn't come from someplace that has a lot of contaminants. So right there you have it. Now, most dog foods have glyphosate in it. So glyphosate is Roundup. And Roundup has an approval as a patent for an antibiotic for the intestinal tract. And I'd say about 99% of all dog food probably have Roundup in it because it's so water soluble, so ubiquitous. It's in all of the dog's food. And if you feed your animal meat, it's in the meat because the animals that are eating the grains from the, you know, or the grasses often have that as well. So it's a food chain that is really damaging. And of course they're chewing and all that stuff is rotating around their mouth and going in their mouth. So, you know, with my own dogs, I try to make their own food. I've been trying to do it for, you know, probably 8 or 9 years now, making it all organic and as fresh as I can, and we live on a you know, with our own well on, you know, 7 acres of old age, you know, of old woods, you know, area. So it's, you know, old growth wood. And so, you know, I'm hoping to protect them more. But I did an experiment, but Vienna and her brother were both with me till they were 4. And I let Budapest go to San Francisco to live with my daughter. And she did not feed him the way I feed him. She fed him regular water. She feeds him kibble. She doesn't feed him like I do it. And a year and a half later, I was out there in November, and I could not believe how filthy his mouth was. I've never seen tartar on one of my dogs, right? So it really shows you that she wasn't caring for him the way. I've never brushed my dog's teeth. She never learned how to brush dog's teeth because she lived in my house and they never got any tartar, but his teeth were filthy, were absolutely filthy. And he jumps into the bay at San Francisco. And when I went walking with him, there's like this brown foam that comes up. I mean, how healthy can that be? And now with the fires out there, how healthy? And he's really not feeling well. He's all congested. His eyes are all congested. You know, he's not really healthy right now. I don't consider him healthy, you know, living with that kind of air pollution that's going on.
Environment, yeah.
You know, and breathing that stuff in. But back to the mouth, you know, getting that tartar off. So what I ended up sending her, and we're doing, you know, an experiment with him, is that she promised me she's going to get, you know, good water, not water from the tap. And we sent her the water bowl water from my dog's mouth. So, you know, after you clean the water, when you clean your water bowl, you feel that slime, which is the biofilm. Now, what biofilm is, and biofilms are getting a lot of attention now, it's all of the bacteria, the dead bacteria, the byproducts of the bacteria, their poop, all that stuff builds up, and it's scaffolding that it sets up. And when it gets really dense, it's really hard to get through it. And so, but if you have good biofilm, I would want to pass that on to someone who has bad biofilm. So we call it biofilm restorative water, where about every 3-4 days, I wash my hands with a natural kind of soap, and I sort of move all the biofilm out, and we put it into jars, and we're letting our clients buy it. And they're cleaning their bowl, not with any kind of chemical, but with boiling water and like a stainless steel bowl, putting a teaspoon of that into some spring water and waiting 6 or 7 hours, almost like a yogurt culture, letting the biofilm sort of set up there, and then let their dog drink it, and then do that for 2 or 3 days, trying to see if we can exchange over it's like having, and like, I don't let anybody's dog come over and drink out of my dog's water bowl, because I don't want them contaminating and cross-contaminating my dogs with some weird species of something that they've developed. So, they've got, they eat raw food, they chew on, old trees, and they dig holes in their mouths or in the dirt. So they've got a lot of really diverse gut stuff. Yeah. So yeah. In any case, that's what we're doing now for the mouth, and I have one client who started doing it, and she said it's made a difference in the dog's breath. So she gave the dogs a raw bone to chew on their own. And so if we can get if the microbiome and the species there are laying down the plaque and the tartar, if we change that, can they absorb the plaque and the tartar? And I think they can. They can actually do that. But when we buy things that, over the counter or whatever, that have a few things in it, it's not the whole picture. The whole picture is this symbiotic kind of piece that we hope everybody can have in their microbiome. So in gut, we're doing the microbiome restorative therapy, and this is part of it, but it's the oral microbiome restorative therapy. But we're doing the back end and the front end. So we'll do ozone, and ozone is wonderful to reduce biofilm. That's what it's used for in biological dentistry. So you can't get rid of biofilm with antibiotics, because it's not always bacteria. It's also viruses and fungi and yeast and everything else. But ozone kills all that on contact. So rinsing the mouth out with ozone helps keep the gums clean, and then it floods the body with oxygen. My mother, who was supposed to do a video, I can't get it, she's supposed to do it last night, but I got her an ozone generator 7 years ago, and she's been putting it in her water pit. And before COVID hit in December, I told her, I'm really worried about this coronavirus, and she's 90 years old. And I said, 91, and I said, you need to be doing your ozone all the time, because it works for this virus. Yeah. So anyway, so I said, you've got to do this for yourself. So she was doing it in her water pick and putting it in her water pick.
Oh, okay.
Drinking the water, and she feels it's like the fountain of youth. She loves, their gums feel so fresh and so good. And so she went to the dentist at the end of February, and the hygienist, who had not seen her before, she was in her mouth and came out and said, in my life, I've never seen anybody 91 years old who has such healthy gums. You have healthy gums like a teenager.
And what is she taking, or what is she using?
She's doing ozonated water in her water pit. So she's using ozone to get rid, instead of using, mouthwashes full of alcohol that are just not helping oxygenate your mouth. They're using ozonated water, which she uses distilled water, and she ozonates it, and then she puts it in the water pick and runs it through the water pick and cleans around her teeth. And it helps with gum inflammation.
And what do you recommend as far as getting ozonated water? What did you get her?
Get an ozone generator, and an ozone generator can have a range of like $1,000 to $3,000 or $4,000 to $20,000. So getting something that is inexpensive, and there's three companies that I recommend on my website that have them, and you can check out their products and stuff like that, and they're all reliable companies, and I like them all, and I try to promote all of them. There's like O3 Vets, there's Promo Life, and Longevity are the three that I utilize, but there are other ones too that are around the world that are really good. But these are three that I've utilized, and I find it to be very, the people that work there are really responsible to clients of mine and stuff. So I really appreciate that.
Okay.
But you have to get an ozone generator, because ozone will not last. It only will last for about 35, 40 minutes in distilled water. So you can't like make it and then keep it out on the counter and use it for the next 3 or 4 days. You can make it and put it in the refrigerator and it will stay longer. So I usually make ozonated water like every day or every other day now with the coronavirus, and drink that to help me protect myself from the coronavirus. So that's what I do for myself. So, but then I don't do it like my mom does, which is in the water pick, which is much better because I don't keep forgetting to go upstairs and do that. But I swish with it, I do like pulling. So, but that's a big piece of how you can keep your gums healthier. And in all my dentals that I do at the clinic, we put ozonated water in the cavitron. So when that water is coming out, it's full of ozone. And there's several really wonderful things that are important. One is it kills biofilm. Now, biofilm is in the water lines of all dental offices and all veterinary dental offices. And that biofilm can be from that first person that got their teeth cleaned, or that first animal that got their teeth cleaned. The machine will suck back a little bit and it gets into that line. And they're required to clean it. But the cleaning solution only keeps it away for a very short time, not even hours. So they may clean it once a day in the morning or at night. By the morning, it's all filled with biofilm again. So you're getting biofilm from your dentist, somebody who maybe left there 3 years ago, but it's still growing in there. So in order to have a really clean bio line, you have to have biofilm going through you have to have ozone going through your line so that you don't have that biofilm. And same thing with veterinarians. So they need to be doing this in the veterinary practice to reduce the infection in the mouth. And we push ozone through all the pockets when we take an extraction out. We'll flush it with ozone. And if it's somewhat infected or painful, we inject ozone right into the socket. And if you go to a biological dentist, they are using that instead of antibiotics. They don't use antibiotics into it. My husband just recently had a tooth extraction. He had an abscess and they just injected ozone into it and he didn't have to use antibiotics. So this is stuff that we need to be showing our veterinarians, that have them read the AVMA report. And the AVMA report, sadly, doesn't give them a tool to do anything with it. They say, don't use it, don't use it, don't use it. But what can you use instead? They don't tell you what to use instead.
Oh, they don't give you an alternative.
They don't give you alternatives. They don't tell you to use different herbs that are really good, in like homeopathics that are really good. And so, with all my dentals, I do arnica and calendula, and if they're gotten anesthesia, we do homeopathic phosphorus, or if there's any bleeding. So that's just standard fare in my practice, is when we do dentals, we just give them the remedies. So, but the gut microbiome is amazing, and that part, we can do a whole segment on the personality changes I see with the microbiome. I see complete dogs that are aggressive and fearful and anxious. They change their personality because the gut-brain connection is real, and it is so important to think about what you put in your gut, how it's affecting all your organ systems. Because the vagus nerve that comes from the brain affects the gut, and it affects it. So it's back and forth with all these organ systems.
Oh, absolutely. Yeah, for sure. So, Stephanie, should we take questions now, or what would you like to do?
Yeah, I think we could totally go into questions. We've got quite a few here. Really, really good questions coming in tonight. This is a great topic. A couple of the comments on Facebook here, when you talked about the biofilm in our dentist office, Dr. Roman, a bunch of us are sitting here going, oh no.
Right, no, it's very scary. And Dr. Dennis Mahalka from Hawaii, he did a study of a bunch of dental offices and measured the biofilm in each one of their offices, and showed how by putting ozone in the water line killed all the biofilm. And my dentist uses ozone in her, and I rinse my mouth before I start with ozonated water, and then during the procedure I'm rinsing with ozonated water through the whole thing, because I don't want to get something going to the dentist, And I feel like if I'm exposed to some kind of virus when it's during flu season, and now, with COVID, I gargle with it. I run it through a neti pot. I do all these things to try to prevent any infection from coming on. And now they found coronavirus in ear canals. So there's stethoscopes that you can blow the gas through your ears. And there's just such a need to understand how to support a good immune system with ways that are safe and effective.
It's incredible, and it's really powerful stuff.
Yep.
Okay, so to get into questions here, Susie's with us. She's got quite a few, and they're really awesome questions. Do resorptive lesions need automatic extraction? Is thuya the best remedy for this, or are there better ones?
Well, yeah, absorption lesions are hard. And I went to a lecture where they had a very, well-known veterinarian in North American Veterinary Conference giving a lecture about, resorption lesions. And I, of course, raised my hand and asked them about adjusting the microbiome. And that's maybe part of the reason why the immune system just doesn't know how to handle it. And, I have one cat that I tried doing that on, who only had 2 teeth left in the cat's mouth. And this was about 8 years ago. When I started doing this, I decided I would do it with my cats, take him in and take, a tongue depressor and sort of scrape his microbiome and clean that tooth and put it back on. And it was, my cat was ready to kill me. He would me for like 2 weeks. He said, I'm not going to the clinic with you anymore. You're terrible. That's why I'm using the water, because I figured this is benign. He doesn't know he's passing his microbiome. But, the resorptive lesions, using a homeopathic for that, I'm not sure I've had I can't tell you any success that I've had with resorption lesions and homeopathics. Have you, Julianne, had where they've done something to come back again? But I have seen videos and actual slides from dentists that have taken teeth that had huge caries in them, and used ozone with a silicone cap and put it right on top of the tooth, and that cavity completely filled back in again.
Filled back in.
Filled back in. It wasn't.
Wow.
It wasn't filled. What it is that what's causing the cavity is bacteria, and what causes pain is the bacteria inflammation. Yeah. And so I myself got another cavity when I broke my leg, where on the same meridian that my leg was broken on, and I got it, and the filling came out, and it was very painful. And what I did is I put also a cap of ozone on it. Pain went away right away, immediately, gone. So it gets the pain right away that from the tooth, because you're killing the inflammation that's causing the pain there. What this doctor did is he took sequential photography of that tooth and showed how it rebuilt itself from being, like half of the tooth was missing. Yeah. So do we need to fill cavities? Can we?
Yeah, really, eh?
Do we give the body the right microbiome that deposits the right amount of calcium and regenerates the tooth to come back again?
Well, but you would think that that's the way we should be going.
Right. And I think that with the cat, with a resorption, it may be too far, that you've lost, your integrity of your gum. You've lost if I had a cat that was starting out to do that, then to try to change that microbiome as soon as possible and get that cat into balance from the front end to the back end would be something I would really want to try.
Yeah. And I think the remedies that I would mostly use is, I really think it's immune mediated, right?
Mm-hmm. Oh yeah.
For sure.
But your gut is 80% of your immune system. So if you reboot with healthy microbiome,
Yeah. And interestingly enough, the remedies that I would use would be carcinosin.
Yeah.
And also the bowel nosodes.
Mm-hmm.
That bowel nosodes
I think the bowel nosodes may be something that, I have Dr. DeHaan is supposed to be making bowel nosodes for me from my dogs.
Oh, awesome.
So we sent him some, about 2 years ago now. So I'm hoping, it fell through the cracks, but if I could, the bowel nosodes are from 120 years ago.
I know
They're all really ancient, but that was before we had all these chemicals in our body, right?
No.
So if the energetics from the bowel work to help change things, that is fascinating to me. So if I could make the bowel nosodes and have those, so we're not, because we ship our poop all over the country. So we send it through on dry ice and in capsules and slurries and nuggets and just raw bulk, and people can get it. I go through veterinarians so that I know that the holistic veterinarian is on their side, getting their digestive system working better, because just to give them a microbiome without nurturing the gut, it is not, I don't think it's as fruitful on everything.
No. And it's kind of like an obstacle to cure, right? That's what I think that's what I think one of the biggest problems of alternative medicine not working, right, is, especially homeopathy, is that if we look at the gut now of a dog or a cat or a person or whatever, and we look at a gut when Hahnemann was dealing with it, very different guts from then to now. So I think we hit a lot of times, we hit that obstacle to cure strictly because of that, and the amount of pollution and Wi-Fi stuff, and like it's just your body's just being constantly traumatized and constantly you're just coming up against an obstacle all the time, right?
Right. And so that's where, when I'm writing a lecture right now, I'm giving a course at the Chi Institute in November to veterinarians, like 16-hour ozone course. And that's part of it, is I think that ozone potentiates homeopathy. Ozone potentiates acupuncture, because you need more oxygen in your body. And that is part of your vital force. You can't live without oxygen for more than a few minutes. You can't live without it. And all of our mitochondria, which is 10% of our body weight, is mitochondria. They're so toxic from the 90,000 chemicals that we didn't have when Hahnemann was seeing the results from his experiments and his provings.
Yeah, for sure. Good point. So is there more, Steph?
Yeah.
More, yeah.
Allison's got a question. Do you think that chronic teeth issues are related to Bartonella?
It could be. I mean, there is so little we know about what is involved with what's in the mouth. Okay, so the 16S that we do, which is that's the standard for looking at 16 species. They're 500 and 1,000 subspecies. So it's like we've discovered the 5 planets, and we don't know there's stars and more planets out there. We know so little about this whole system. And yes, there could be Bartonella. I had another veterinarian, Marty Langerham, who's in Illinois. He told me about this My Dog company that does 100 species and looks at 100 species and does cultures on 100 species. And he had a horse that had a abscess on its back of its withers, and he took an aspirate of it and sent it out and injected it with ozone. But it came up positive, like really high positive inside this abscess, was Lyme. There's no culture and sensitivity for Lyme. So they can't culture out Babesia in the mouth. So we have to find, there's science has not met what we project we can see in there. So looking at these, once we have a 16S, we need a 500S, but that's going to be maybe, I don't know, 10 years from now that we can actually.
When you think about Bartonella, or you think about Lyme, or you think about anything like that, that's the biofilm, right? Like that's what you want to seriously focus on anything like that.
And getting rid of the biofilm is, there are different things that we can use. Like I use a lot of, plant enzymes. So my dogs get fresh blueberries, fresh raspberry, berries, blackberries. And then I put papaya in their fresh papaya into their mixture too as well. So, and then I give them other ones that are dried, digestive enzymes. But those amylase, lipase, papain, bromelain, they help break down the biofilms, but also the aromatic herbs. So things like turmeric, or and even clove, but certain ones you have to be careful with certain animals. But what I was listening to a summit last night, and he was talking about how, in our diet, we don't have these aromatic herbs as much in American culture. We just don't eat them as much. And they really are something that helps break up biofilm. So, there's certain things that we should look into eating more of, so that we can break up the biofilm so we don't have them forming. Because once they set up their scaffolding and once they're there, it's really hard to get them to remove themselves, and they keep blocking your ability to get rebalanced, or your animal's ability to get rebalanced.
Awesome.
Do you ever use ozone for something like that?
Yeah, I mean, we use ozone to get rid of the biofilm in the gut prior to the fecal transplant. So we put a catheter up as high as we possibly can. We sort of seal the anus and then push the gas in. And what my hope is that it travels up through from the descending colon to the transverse, and then it goes around the curve there. Then we let the dog go out and defecate after about 10 minutes, and hopefully disrupted some of the biofilm with that ozone. And then we make our slurry of the fecal transplant, and we put it back into that location and massage it around. So trying to basically like blow a hole in the biofilm so that this new microbes can find some little place to live that is not, it's like having them set up on top of a slimy surface. They're not going to stay as well as if they can get down into the crypts of the colon. So I heard another statement which I thought was really amazing too. Was it said if you took this is a human, you took the small intestines and you pulled it out to do the surface area of the small intestine, it would be the size of a football field. The surface area of your small intestine is the size of a football field. And the biofilm and the bacteria is like putting peanut butter all over a football field. So just imagine the volume of what is on the surface of that. It's like this layer of peanut butter over a football field. So how do you change that? How do you get that to be as positive for your immune system as it can be? And that is, science is not there yet. We've got a lot to learn. It's just fascinating to me.
Each species and each strain has its own intelligence and its own ability to do things that we don't even have a clue yet.
Exactly. I mean, I feel, the more I read about this, the more I feel stupid. Like because we don't know what these species do. If there are 500 species, and in 20 years from now, they've identified 400 of them. If they can figure out that Mrs. Jones, who has MS, is missing this species, and this species, and Mrs. Smith doesn't have MS and has this species and that has those species, then maybe, having a transfer from somebody who can give you the species you're missing and then regenerate your own symbiotic, balancing of your body. So I think the future is really fun. And I see the differences in our animals, and as as a veterinarian, I feel like the more I can do for them, the more I should try, which is the first thing now I start with is let's get the gut doing what it's supposed to do. Let's do a microbiome restorative therapy. Let's give it the nutrients to expand the ability for this microbes to live there and find a home, and let it be part of the whole reconstruct of that gut. Giving one probiotic or 5 species is just really a small drop, but it's helpful. It's better than no drop, but the whole, there's so much going on there.
The diversity, I always compare it to the ecosystem of a park, right? It's just, there's so, if we don't have that diversity, we can't sustain homeostasis, right? So I think it's when we think that without homeostasis, what happens? Everything collapses and dies, basically. And I think that that's where it stems from. I think that the diversity of the bacteria is what keeps our homeostasis
Right.
happening.
And, and who would have thought that something like that was really running our immune system? And thank goodness it has the respect. I think many holistic doctors were always trying not to disrupt the body in any way, and not really knowing that this was the big component of it, was that all this microbes and all the relationships and the mycoplasms and the yeast and the fungi and everything, they all have a purpose. They're all there for, we're not trying to knock them all out and kill them all. We want to keep them as wholesome and whole and interrelated as we can.
As we can, for sure. And I think what has happened too is I think that the microbiome has even taken holistic vets back to what holistic really means. Because for a while we were, a lot of holistic vets were starting to compartmentalize, right? Like they were using natural things, but one thing for the brain, one thing for the teeth, one thing for the hair, one thing for this, it was still compartmentalized. Whereas when you look at the microbiome, we understand the importance of it in its entirety, right? Of every.
I mean, you're hoping that because all of it, when you do a course of antibiotics, for a sore toe, you're disrupting your eye flora, your ear flora, your mouth flora, your nose flora, your brain flora, your stomach flora. I mean, you're going after an infected toe. So don't put them on systemic antibiotic, bag them with ozone, soak them in ozone, use Manuka honey, use something else that's local in that toe versus a systemic approach to kill everything for this little bacteria in the toe.
Or even deciding as a scientist or whomever, what we should be getting rid of, like eradicating. So the understanding now that we shouldn't be eradicating anything, even E. coli, Clostridium, and Salmonella are important bacteria, even though they're pathogens, to be in the gut. They shouldn't be eradicated.
Right.
Totally. Right. And I think, the same with yeast, the same with Demodex, the same with so many different things. It's all supposed to be there. And it's just supposed to have, the friendlier ones are supposed to have an eye on everything, keeping it in balance.
Right.
You wouldn't think by removing something that's a pathogen can actually cause a domino effect that essentially destroys the whole ecosystem.
And and that note, I've been practicing a long time, for 42 years, and I mention this a lot, that when I started practicing, that cancer was rare. Cancer is really rare. And now it's over 50% of the dogs, maybe 55% of dogs getting cancer. And it said by 2020 it would be over 50%. And I totally agree. I was spreading 2020 back in 1999 when I made that statement. 2020 there'll be 50%, and it's more than that now, and it's sad. I have a 2-year-old lab that I care for. She's now 3, who's had lymphoma and brain cancer, and now has a nocardia. I mean, it's just what's happened to these immune systems, that at 2 years of age you have lymphoma, and then the owners have probably, thank goodness they had insurance, but it's probably $60,000-$70,000 they've spent on this dog. I mean, it's crazy, and it's still not a healthy dog. So it's just, there's something really, really wrong with what we've been doing, and I am hoping that the owners and the veterinarians can start to look at the bigger picture of the immune system and not think, oh, it's an ear infection, let's put them on systemic and topical antibiotics, and set that puppy up, at 6 months of age that has an ear infection for a trajectory that's downhill. Downhill, because they're too, we just got to, and now with this responsibility that veterinarians have, they are going to be responsible. They're responsible now, because the AVMA is calling it out and saying, we've got to be judicious about this. We've got to have good stewardship. And, it's an important piece, but that's where, as clients or veterinarians that are listening to this, find other ways, be curious, listen to people that have had results using other modalities to successfully, manage infections.
Wow.
Yep.
I'm sure we're all sitting here with our jaws on the floor. This is an incredible session. Can we ask a few more questions?
Oh, sure.
Erin's asking really quick, Dr. Roman, if you wouldn't mind repeating the name of the dentist in Hawaii.
Oh, yeah, his name is Dennis Maholka. He's on the Big Island, but he doesn't practice anymore. He's retired. So, but he did the study on the water, the biome film, and you probably could find it on. I did publish an article, but through the the ozone dentistry. So look up under ozone dentistry and biological dentistry, and you can find dentists that understand the danger of this biofilm that people are getting in when they have their teeth cleaned. I mean, I think, you know, I'm thankful that my dentist uses ozone, but you know, I feel bad for anybody else who aren't even aware that this is going through the water line. You know, and if you ask them, oh, will you disinfect? Well, how often do you check to see if you have bacteria? Do you take a check every 20 minutes to see if bacteria come back in your line? They're going to go, you're nuts, you know, don't tell us about this. But they all need to be reading about this because, you know, as we understand more and more how this part connects to the rest of our immune system, we want to have things done in a way that help protect us.
Yes, yes, it's important. Julie, do you have anything to add?
No.
Donna's got a question. Can you ozonate coconut oil to help do oil pulling?
Yep, you can. It's coconut oil because it doesn't stay liquid if it gets cool. So I know PromoLife, which is a company in Arkansas, and it's promolife.com. They make ozonated coconut oil, and you can use that for pulling. But you can also use most people. The main one the oil that's used is olive oil. That's sort of the standard oil that's used. But they also at PromoLife do hemp oil, jojoba oil, avocado oil, coconut, sunflower oil, and there's like one or two others that they've done. So you can get a variety if you're sensitive to one particular oil. And they make it in tubs, and our clients get it, and it's great for wounds. I have clients buy it and use it on the teeth, you know, to put on the mouth, and it helps break up the tartar too as well, because it's dissolving some of your biofilm. So they actually do make ozone toothpaste now. Eric Zeminski, who has ozonatedoils.com, he makes ozonated deodorant. He makes toothpaste. He makes lip balm. You know, so you're not using, you know, chemicals. You're using like ozonated oil on your lips, and it prevents the chapping. But it also, and what I do is I put it in my mask. I lost my spleen in veterinary school, and I got injured by a cow, and cow threw me against a fence, and the farmer was too cheap to put good fencing, and so he had 5-inch nails, and it went through, hit my pericardium and my sternum almost 43 years ago. And they told me I wouldn't survive, you know, and I was going to never live after that. But anyway, it's a long story, but I have been always looking for things that I can do to help me fight viruses. So I've lived in a surgery mask going on planes for my entire life. Okay. When I take my kids to the pediatrician, I wore a mask and gloves. I mean, my kids all now they go, oh, my mother used to do this all the time. Like, you know, old hat for everybody. But, you know, I put ozone into now for the last 10 years or whatever. When I go on the plane, I put some ozonated oil right in my mask, and I'll put some thieves or something like that in the mask. And, you know, I'm breathing the ozone, I'm breathing the thieves. And, you know, if my breath is bad, I'm not breathing my bad breath, you know. So but I'm doing something to stop viruses, to you know, help with you know, preventing infection.
Awesome.
So the ozone stays viable in
like
oil.
Yeah, well, I keep it in the refrigerator, so it stays pretty hard. It's almost like lard in the refrigerator when oil gets hard.
Yeah.
So you have to dig it out. Like they also make ozonated suppositories, so you pop them in. And I, you know, one of the dogs I did years ago had adenocarcinoma of the colon, and they had told him at Tufts they didn't resect the entire colon and do a bag and all that stuff. They only had 2 or 3 months to live, and that dog lived 3 years and mainly got ozonated suppositories. up in that area. So ozone suppositories are amazing too for any kind of vaginitis or on the animals. And, you know, all this stuff I'm telling you about is in animals, because that's what I do, is practice on animals.
Mm-hmm.
You know, and clients will give me anecdotal cases about themselves, because I get many clients that come to me because they've been doing ozone on themselves, and they, you know, they'll make statements about, I had this and I had that and I had this and I did this, and like, whoa, you know, and then I'll try it on the animals too. And then I'll, you know, tell them about their animals, and they'll, you know, whatever, they'll extrapolate for themselves if they want, you know.
Yeah. Wow. That's awesome.
But it's amazing. It's some very simple stuff. And the ozone generator was invented by Nikola Tesla in the 1880s, patent. So, you know, Tesla was considered one of the top 100 brilliant people for the last 1,000 years. You know, so he was a very, very intelligent person. And, you know, to consider it, you know, something that we shouldn't look at and talk about when we're in a viral outbreak right now, it's antiviral. It's been used for antivirus for years. In human medicine in Spain, they've done 600 patients in Spain in February, 100% success treating. So there's articles about it. You can read about it. We need to empower everybody to know there's ways of helping ourselves and helping, and other countries are proving it with the research and double placebo blinded studies and all that.
No, I just hope it doesn't get, you know, it's like even with cancer and things about like we just, so much of it's hidden, right? Because they don't want, it's almost like I'm not saying that they don't want to find a cure for COVID. That's not what I'm saying. But if they find all of these things that work, you know, like it's just so sad that it's just not out front.
So I think people have a right to understand things. People have a right to read others' research information. They have a right to look at this literature, and it's out there. And how can we get our politicians and our doctors and have people that are saying, we don't have a tool here, we don't have anything, you know, why can't we read research from someplace else and deduct it that it would work on Americans just like it worked on Spanish and Italians and Brazilians and Cubans, and you know, and why can't, you know, we need loud voices. We need people to ask the questions. And you know, I think when the pandemic first started, you know, you couldn't say anything, and you still can't say anything. But I think now we're into it for quite a long time, and maybe we're numb, but I don't think we should be. I think we need to be having a voice out there and asking the questions, and, you know, asking people to say, why not? We have a right to, it's compassion care. We have a right to try something for our family. And, you know, just, it's sad. I mean, I know I was just watching before that came on, they had on the news about a lot of people were going over the border to get treated for COVID over the border in Mexico. And I was hoping they were going over the border to get ozone therapy, because they do a lot of ozone across the border in Tijuana for cancer. They have all the cancer centers do ozone, ultraviolet light therapy, hyperbaric oxygen, and it's a lot less expensive than it is on the other side. But they were talking about buying drugs, you know, prescription medication, or maybe they weren't, but that's what they implied on it. So, but I was like, oh, great, finally somebody's talking about going over the border to get this care done, because we can't seem to get it over here. So, but you know, I'm hoping that our politicians and our doctors who are supposedly looking for the best ways to care for their patients and want other solutions. And the same thing with the dentist. They, you know, they want you to have healthy gums and healthy teeth. And if they realize they're so upstream, and whatever they do in your mouth affects everything you go downstream. So they need to, you know, be good stewardships of the mouth and be taking care of it, and not contaminating it with biofilms from somebody who had bad.
The more stuff like this goes out, the more the public actually pushes that, right? They public demand is what actually creates change a lot of times.
Yeah. And I think, you know, I think all veterinarians and all doctors want their patients to be as healthy as possible. And it's just giving them tools, and the tools they feel secure with. you know, they're not feeling like, well, I don't know what I'm doing here. You know, I don't know what I'm doing versus, well, let me learn something about doing it this way.
Yeah, for
so
sure.
I have confidence doing it.
Well, especially something like ozone, because it's not like homeopathy, right? It's not such an intense modality that you have to
Right.
years and years and years and years and years trying to figure out. Like ozone, it's got the science, it's got the backing, and it's easy to apply, right? It's not like it doesn't have to take years of study to figure it out.
Right. I mean, you know, doctors and dentists and veterinarians can learn ozone in a 3-day, 4-day, 5-day class, and then, you know, start using it and then expanding on it. And when I teach the ozone, I tell people it's like, it is like a new frontier. I mean, when I started doing it, I didn't know what I was doing. I had nobody to teach me anything. So I would just sort of try it on something, and oh my God, I was like, that is really cool that, you know, I took that wound that I would normally put, you know, antibiotics and drains and everything into it, and I put ozone through it, flushed it with ozone. Next day, dog's running around, no infection, no. And I'd be like, oh my God, you know, and the more I did that, the more it was like I shocked myself. And then if anybody wants to watch this video, it's a PowerPoint. And if you have a veterinarian who's like, I don't believe in this stuff, have them watch this video. And I'll tell you the backstory. This was a dog, May last year. I was at the high school, and there was a woman in her car weeping who I knew who she was. And I went over and said, what's wrong? She said, putting my dog to sleep. She's been down for 3 days. We took her to the vet 10 days ago. They did lab work, and they can't find anything, you know, for sure, but we need another $1,800 worth of diagnostics. And I've lost my job. Well, my job is very minimal. My husband's very minimal. We can't afford $1,800 of diagnostics. And she collapsed 3 days ago, and we're putting her down. I said, well, you know what's wrong with her? She said, no. I said, you know, she's an intact female. And she said, yes. And she said, I saw a little discharge from her vulval size. So I thought, maybe it's a PIO, you know, I'll go and just see. So I said, have your husband meet me at the clinic. I raced over there. The dog was morbid on the floor. I couldn't even lift his head up. It was just, you know, she was just down and really, you know, just collapsing. Her belly was expanded, but I'd never seen her before because she could have been just a, you know, chubby lab anyway. And so I said, you know, if it's a PIO, I will try to fix it. If it's not, then we'll put you to sleep on the table. But if it's something that I think I can fix, let's try, right? So I had her on the table in about 15 minutes, and I made a little incision like this, and pus just started pouring out. The uterus, I had a client of mine who was a forensic pathologist, and she said the amount of adhesions that I documented on that uterus, it had ruptured 72 hours before when she collapsed.
Right.
So for 72 hours, this dog had been totally septic, full of pus. And so I thought, if I tell the owners that this dog is going to need intensive care at an emergency clinic for 3 days on drains, on antibiotic, you know, on all these different antibiotics and stuff, they're going to euthanize the dog on the table. There's no way they don't have the funds to even cover the surgery. I said, but if I won't say anything. I've got ozone, I've got UVBI, I've got homeopathy, and I've got acupuncture. So I went and I took the omentum out, and not out, but I laid it out, and I washed it with ozonated saline. The saline maker in there. And then I flushed the abdomen, took the uterus out, and then flushed the vaginal area and flushed that, you know, big clots of pus out of there. Did acupuncture and gave it, you know, 10M arnica, Bellus perennis, and phosphorus, and you know, and all I had in my clinic was injectable amoxicillin, because I don't do a lot of antibiotics. So I had injectable amoxicillin. So I gave the dog amoxicillin because it was a ruptured pyometra, right? So you have to do some antibiotics. So I started the surgery at 12. At 5 o'clock, the dog went home. It was sitting up drinking water. It wasn't even sitting up at the clinic when I went in. So sitting up drinking water. It went home. The next day it came in, and I gave him more arnica and more Bellus and Rimadyl to take home for pain. And the dog she said, the dog's not been in pain, because ozone stops pain. Just like with the tooth, it stopped the pain, right? And so we did, the next day I did intraperitoneal ozone gas, injected ozone gas right into the abdomen for peritonitis. and did more UVBI with the hemolumin, which is what we did the first time. And then kept it on. I gave it Clavamox because I thought, this is the time you need antibiotic, Margo. You have to use antibiotics, you know? So I gave it like 3 days, 4 days of Clavamox. And then the dog was fine. I thought, we don't need to keep it on antibiotics. We're doing ozone. Ozone's better than antibiotics. And that dog completely recovered like in 3 days. And I have one of my technicians who was there who just joined my practice. And she said, when she saw me doing this stuff and thinking that I'm not going to put drains in and do all this stuff. And I thought I needed to do drains too, but I thought, well, let's try it. You know, they're going to euthanize this dog if we have to do any more care. And, you know, it was a miracle, or it was a miracle, or it was a miracle. But I think it was ozone and UVBI, to be honest with you. And then the homeopathics and the acupuncture, you know, so, you know, why not utilize those things? So that PowerPoint is on the MASH Vet site, and you can see the surgery. And, you know, the first part of it I don't have, where I was like, oh my God, we got to film this, you know. So, but who knew that it was going to come out like that? I mean, maybe it was luck, but I've seen surgeries that have been, you know, terrible infections and stuff, and they've come out so much better having ozone as an adjunct. It's totally addictive for everything.
Yeah, 100%. I would agree with that.
Wow.
So,
do we have time for a couple more?
Sure.
Yeah, is that okay? There's a theme here.
Yeah.
There's two questions that I was hoping we could ask. One of them is, can we use ozone to help with things like Alzheimer's? And then there's another question that's similar for cognitive issues. Can ozone help with that?
Of course, I can't treat people because I'm a veterinarian. So I want to say that because that's important for people to say. But I go to a lot of conferences that are 99% physicians. And I'm usually the only vet there, or maybe there's 3 vets there or 2 vets there. So I love going to those, what I consider one health, one medicine conferences. So we have dentists, we have chiropractors, we have physicians, and then there's a few veterinarians, and then, you know, it's just an array of medical professionals and homeopaths, and that there's a lot of the physicians are trained in other alternative modalities. And it's really great to talk to these people and see their results. And yes, Alzheimer's is being treated with ozone, okay? And I personally think that the microbiome is so important when it comes to cognitive, and because the gut-brain connection is, you know, if you don't have the neurotransmitters that run your brain and the firing of your brain, how are you going to get that back? I mean, if I look back at cases, when I had a little Jack Russell Terrier, it wasn't Jack Russell, it was a Jack Russell, it was a terrier, just a, you know, short and smooth-haired fox terrier, and she had dementia, and she had liver cancer, and they gave her so many weeks to live, and she was totally demented. She just would walk in circles and walk in circles. And we did ozone and UVBI. And the next day she went to the door. She wanted to go for a walk. She pulled them to go to the park. She hadn't done that at all. So was that more oxygen to her brain? And that's what I decided it was, that because ozone is predominantly, it's 97% oxygen and 3% ozone. And your brain needs more oxygen than anything else. So if you're giving higher amounts of oxygen to the brain, you know, and so the dog was great for about a week and a half to remember everything, and then slid back down again. We do it again, and she was back running to the park and doing stuff, and, you know, and it helped her liver cancer for a long time. She lived like probably another year after they told her that the dog should be put down. So, you know, but the cognitive part was something that I learned from that. And then, you know, with an older dog, giving them the microbiome of a younger dog is really fascinating, right? You know, an older dog that I treated with liver cancer, and that would take about 20 minutes to go through that case. It was an amazing case, this dog Baxter. But the part that I want to bring that up is that he had liver cancer, and he had really been really sick, and we gave him a fecal transplant. And he was 14, and we gave him a fecal transplant from my dogs when they were in heat, and he started humping his bed and was like a young dog yet. It was so, they were like shocked. He said, I haven't humped his bed since he was 5. And he was humping his bed and so happy and was running outside. I mean, they were like, it was like this switch flipped that, you know, here he had this energy that he didn't have before the fecal transplant. I mean, really very almost within a short period of time, like within like 48 hours. Pretty cool.
It's incredible. Julie, can we do one more here quick? Yeah. So a common theme has been, you know what, how can I get access to this ozone without purchasing a machine, or you know, the budget's tight. Is there anything I can do to help?
Yeah, I mean, getting ozonated capsules and getting ozonated suppositories and getting ozonated oil, you can start with that. You know, the ozone generators, like I said, can run, you know, between about 1,000 to, if you get all the attachments and stuff, probably 1,300, you know, to get all the parts to it. But you can buy the ozonated suppositories and capsules and those products from the vendors I have there, or ozonated oils. There's a bunch of them now that are coming out with ozone. And there was even companies that are coming out with ozone cosmetics because they get rid of wrinkles. Because you're oxygenating your skin better.
Really, really powerful stuff. Like, this has been such an incredibly interesting session.
Well, ozone, I mean, both of these things to me are in hand, because in order to be successful with the microbiome, you need to get rid of biofilm. And the way that, you know, if somebody has C. diff, which is Clostridium difficile, which is the only thing in the United States that's approved for fecal transplants. And the word fecal transplant is a term that I just thought was gross. So I changed it to microbiome restorative therapy in 2012. And I said, I'm not going to call it, we're going to call it microbiome restorative therapy, because that's what we do. And we have a very good website, which is microbiomerestorativetherapy.com, that you can link to the MASH vet site and get a lot of I have 2 pre-vet students that are helping me get all the new research articles on the microbiome that you can read. They're fascinating. I mean, just the kidney functions and I see it in the animals who have kidney disease, and doing ozone on them and having them turn around, but then doing the microbiome and they start eating again because their gut is not so torn up, you know, from being so tough.
I just wondered if the girl that asked about Bartonella, whether she has it, right? Whether it's her or her dog or whatever. Mm-hmm. And I do know how important like the biofilm and stuff like that is in Lyme, right? Mm-hmm. Like, it's really important that nobody really looks at.
No, I mean, and I think there's a lot of doctors that are beginning to respect that and understand it. We still don't know anything. We still don't know anything. I mean, it's just in the last, I mean, in 2001, there was one research paper on microbiome. Mm-hmm. In 2016, there were 7,000 papers on it. Now there's probably 50,000 papers on it. It is such a hot research topic. And I've been fortunate enough to go to a bunch of microbiome conferences, big, huge medical conferences on microbiome, and been a speaker and been on the panels and stuff. And it is fascinating. I mean, maybe I'm just fascinated.
No,
it's really fascinating stuff. It's like, oh my God, you know, can we find solutions for this disease and this disease and this disease in people?
Well, I think they have. I think they've isolated a strain and a species for Alzheimer's now. They actually do know that there is 2 species that are directly correlated with Alzheimer's.
Yeah, I mean, it's wonderful. If we could pick that out and find that and just do something as simple as rebalancing their gut flora. Oh my God, wouldn't that be tremendous?
Yeah, and the girl did put in the chat that she does have it. It's herself. Uh-huh. And like for sure, gut health is so
ozone is really important for them.
And
I use you know,
combined.
UV, you know, the UV, and she can find an ozone doctor who does UV. You know, and you can go to the American Academy of Ozone Therapy. They list physicians that that are, you know, using ozone. Also Google in your town, you know, medical doctors doing, you know, ozone therapy. And some are out there and tell people they do it, and others feel like they have to stay under the table a little bit to keep, you know, boards from attacking them and stuff.
Yeah.
But, you know, we have a right to take care of ourselves. You know, we have a right to look for the best for ourselves. We have a right to treat our own selves. So why can't we do that? I mean, that's I think you know, allowing your body to heal and do what it can is really important.
Is it ever? Yeah, for sure. Taking control.
Yep, absolutely. So, but you know, again, I was Julie. I looked at some of your products, and I have clients that use them, and Peter's probably watching, and Peter's, you know, telling me about all these products and stuff. And I'm so glad that you have a background in homeopathy and you respect the vital force a lot, and that's really important because we need to, you know, respect this component that often we think we have to, you know, be overpowering with it and not giving it a chance to try to take care of itself. And sometimes we have to, you know, you have a hit by car with a pelvic, you know, fracture, you can use your homeopathy and use that to bring down the swelling and do all that stuff. Yeah. But you also want your, you know, and the same thing in human medicine, you know, but for them not to respect what you can do energetically with the body with a homeopathic remedy, is not giving the body a chance to heal faster. And that's what I'm hoping that doctors see. Yeah, it's not just, it's not, and if they believe it's placebo effect as physicians, and it works on animals, then I guess, you know, animals really understand placebo effect, and I think it's really wonderful that they do. you know, I think they do. I think they understand placebo effect. You know, I mean, if I give them something and they feel better, I think they understand that I'm trying to make them feel better.
Oh my gosh, of course they do. Yeah, they do. I know that I think they do. So do I.
So, but if you can get something to work by placebo, oh my God, that's really good, right? That's like the best. The mind take care. And that's the whole thing. If the gut and the brain are connected and the mind can control the gut and it all goes back like this, why is that a bad thing? You know, that is a good thing. That's a really good thing.
That's a really good thing, for sure.
Amazing, ladies. Dr. Roman, before we take off for the night, there's been quite a few questions. Number one, do you take phone consults?
Okay. Yes, I'm, you know, because of my loss of spleen and paralyzed diaphragm and asthma that's under control with homeopathy and acupuncture, I haven't been going to my clinic, but I have 2 associates that are at the clinic. And so I do virtual appointments with them. And I also do virtual office calls. So I am licensed in Massachusetts, in Florida, and California. So I actually can see patients in those states. But so if I have a veterinarian on the ground and you have a veterinarian that wants to learn something, I'm happy to do some type of and I've done this multiple times last month, to get the veterinarian, get the owner, and do a Zoom call. So that we're all learning stuff and getting information. On my website, on the MASH Vet, I filmed my certification course, which is not certified anymore because I didn't renew it. But there's 8 hours of ozone lectures that were part of certification. And for veterinarians, they can take that. And then we're going to be having the Chi Institute is having 16 hours of me lecturing, which I'm in the process of going through the slides and getting it all ready to start filming. But it was supposed to be live, but now it's going to be on a, you know, on an online format.
But you send your restorative therapy all over.
Microbiome, yeah, MBRT, yeah.
Yeah.
So microbiome, yeah. So we ship it on dry ice, and that's the bad part about it is that that shipment is expensive because we're not shipping, you know, big chunks of meat or something cross country where we have huge amounts. So we do next day air, which makes it very expensive. So The shipping into most parts of the country is like $140, which is a lot. I wish it was not, and I could do it for a lot less than that. But they can go online, and for veterinarians, you know, they're ordering to have it on hand in the practice. So the capsules, they can dispense the capsules. Everything's kept frozen, and so we ship it out frozen on dry ice, and it gets there next day. And you keep it in your freezer, and we don't know how long it lasts, but they found microbiome, you know, live microbes on mammoths that died, you know, back in the thousands of years ago, right? So, you know, how long does every species last? And I have no idea. And what is lost when something is frozen? I have no idea. What is lost when something's freeze dried? I have no idea. You know, there's components of each one of these things. So the best is, you know, doing it fresh as possible, you know, and that's my feeling. So, you know, doing them at the clinic, I feel, you know, we're doing it as fresh as we can because everything is collected and taken to the clinic right away, and it's processed, and we have like a whole system in a whole special space in the basement that we have a minus 90-degree freezer. I mean, we've built it up where it's there to be responsible and get it out to clients and to, you know, our clients are lucky because they just pick it up right there. But, you know, the veterinarians can have it shipped. I don't know about Canada. We haven't tried to do it from Canada. So, you know, but but it might be possible that, you know, we get a huge shipment, ship it to you, somebody drives it up, and then you ship it out from that direction, right? You know, because we haven't tried to ship it across the, you know, I've had, you know, clients from Canada to come down and get fecal transplants and do that. But we haven't tried to, you know, ship it because if it's 2 days late, it is a big deal because it's already thawed, you know. So we don't want that to happen.
No. Yeah.
Or, you know what, a few of us could go in together and split the shipping or something like that. I mean, there's always a solution.
You know, absolutely. My thought for people in the States. So, you know, for going to Canada, I don't know if you can get next day air in Canada. You know, what you might have to do is to ship it someplace on the American side and somebody drives it over. You know, like ship it to a clinic.
That's mostly what has to happen, or else if it gets stuck in the border coming across on the plane,
yeah,
and it gets stuck there for a day.
Yeah, I mean, so that's why we haven't tried to do it, because it's just so expensive for the shipping, and then they get it and it's like mush, and, you know, is it still good? Yes, but I'm trying to be as good as I can be.
Yeah.
Right. You know,
there's a certain thing I'll email it to you, but there is a thing that you can apply for, and it's considered live specimen, non-harmful live specimen something, and you get it okayed with the FDA and Health Canada, and it just goes back and forth. Like, I've sent a saliva test and I've sent a bunch of urine, and I'm like, how can I get like my own urine across to like different labs and stuff, and my saliva, and it's like, how does that happen? And they're like, it's a specific thing, and it says right on the thing.
Oh, okay.
Live specimen, non-harmful, blah blah blah. Like, it's a thing you apply for.
How do you like, how do you know something's non-harm? I mean, like, you know, they don't stop you when you go across the border and you do a colonic to get rid of.
I know, but I think
you have to get rid of all your urine and your, you know, before you go across the border. I mean, really.
I know. Well, I even thought with COVID, there's no way my saliva is going to go across.
Right.
Went right across.
You know, it's like, you know, I don't want to raise red flags that everybody has to, you know, evacuate before they cross over. You know, it's not going to change because it's in your mouth and it's going to keep coming down the tubes, you know. But.
Yeah, exactly. But that's something you could look at, because then it wouldn't get stopped, and there would be like a 24-hour would get over in a day.
Okay, I'll have my staff look into it. I just, you know, worry about sending a lot of stuff and then it's like stuck and it's not there, you know.
Yeah, no.
I would feel more comfortable if we found somebody who, you know, had someplace that we could directly mail it in the state, and they drive it over.
Yeah.
be my, my go.
Okay, well, there's been lots of people on tonight. Maybe we'll find someone.
What Nate just suggested that maybe we hitch a ride on Billy Hokeman and Answers Order when they bring it to Canada.
Oh, yeah. Yeah, that's true.
So yeah, Answers drives up a truck.
I think so. Maybe we could.
Or they're going to be sending it via plane, but it's definitely going to be on ice. It has to be frozen solid when it gets here. Yeah, maybe we could. They could
those options.
Tag along.
Absolutely.
Yeah, I mean, right now with COVID, not many people are traveling anyway, so it's not, going to happen right now. But it's, it's still, it's just something that you guys have. Everyone has access to getting the microbiome, at least in this country, so they can get it, from our dogs.
Good.
Amazing. Thank you so much, ladies, for tonight. This was an incredibly powerful session.
Oh, thank you.
Lots of good stuff.
You learned something from it, and I ask you guys to be watching some of these. There's an excellent documentary series called Interconnected, and you can download it. You can pay something for it, and sometimes it's free downloads. And then they have one on the mouth flora, and that's fascinating too. So there's such great stuff that is being brought to the audiences, general audiences, that it's to me, I think it's just fascinating that we're finding all this stuff out when you sort of had a hunch all along, but then for them to actually prove it is really cool.
Yeah, very cool. It's exciting stuff.
Yeah.
Mm-hmm. Thank you. Thanks, Dr. Roman, for being on.
You're welcome. You're welcome.
Thank you, Julie.
And thank you, Julie, for helping support all those animals that, from people that are wanting to try other ways of doing things. It's great. Thank you.
Yeah, well, it's a collaborative approach, right?
Yep.
Like, that's why I'm doing these and bringing as many different people doing as many different things. Because it's when I feel like we all have to support each other, right? It doesn't, like, collaboration over competition is ideally.
Absolutely. And that's where, in all the areas, that if we could ever have everybody trying to build each other up, everybody's going to have a little bit better this or better that or better this or better that. But if those of us that are really trying to change the understanding of how the immune system works, and not just trying to constantly be pushing it under the table, I think we all need to be much louder, and out. And
that's what I'm hoping to do is strengthen numbers. So rather than, you over here and me over here and my company here and someone else's company over there, it's like, just let's all get together.
Exactly. And those companies that are distributing stuff to say, I'm not making this product, but she's making this product and he's making this product. And, the best one for your dog is this, best one for your cat is that. And I may be making this product, but this actually is probably better than what I have, because your animal has this, and I don't make something for this and this and this.
Yeah, I do that all the time.
Yeah, so I think it's important for us to just help each other, because the hope is that we can move this into mainstream thought, and that people aren't rolling their eyes and saying this is just placebo. But I love placebo.
Exactly.
Get the brain to make your body healthier. Oh my God.
I know. Yeah.
That's
they even talk about that, about the heart congruence in the brain, right? Like everything is just so connected. It's incredible.
It is.
So when you talk about
your body knows, and it's like, listen to it.
Yeah. Yeah. So those hormones that your brain produces when you feel good have some pretty powerful healing abilities. That's for sure.
Yeah. So everybody stay healthy out there. Okay. Yes. All keep your brains healing everybody's bodies.
Yeah.
Thank you so much, ladies. That was a great session.
Okay.
Thank you.
Good night, everyone.
Good night.
Bye, everybody.